Hello, thank you very much for inviting me today, thank you. I'm going to talk to you, I will have notes because I don't have a great memory. I'm menopausal. Thank you for inviting me today to speak to you about an exciting project which ASCN UK are leading. And the project aims to secure and protect services for ostomates nationally. Throughout the presentation, I will refer to people living with a stoma as either ostomates or patients. I hope that's okay with everybody in the room. As Gordon said, I'm the lead Stoma Care Nurse for UHBW in the South West and Honorary Treasurer for ASCN UK. I'm going to talk about the project, about why it's needed, what it is, and the vital benefits to both ostomates and specialist nurses. So, this project, Advancing Stoma Care Services, is about protecting and securing specialist services for ostomates and also for the specialists that look after them. And it's particularly pertinent now. The landscape of healthcare, nursing, and health advocacy is constantly changing. And we all know there's various reviews at the Department of Health and NHS England, level. Effective advocacy has never been more pertinent, and raising our voice collectively is vital. I'm passionate about nursing, but I'm even more passionate about nursing in conjunction and partnership with patients. There is no us and them in stoma care, which I do think sometimes is present in the rest of the healthcare system, and in my opinion, that divide fails us all. So in nursing, I believe we know we make a difference to individual outcomes, experience and lives, but actually as nurses, we're not so good at demonstrating this. And we're even less good at recognising and showing the wider positive impact we have on healthcare services, on our communities and our broader socio-economic landscape. This project is an opportunity, and in fact, it's a responsibility to show the difference we make at a policy level. Because sadly, there is an assumption amongst those that do not know that stoma care nurses just change bags. This is offensive on so many levels, because supporting someone to adapt to and manage a stoma is one of the most challenging and rewarding things I have ever done, and it remains that way for me today. And as you've heard, I've been in it a while. It's a privilege I never take for granted, and it's a set of skills I will always cherish. But even more than this is that apart from offensive, this assumption is actually dangerous because it leads to an erosion of skill expectation, which leads to clinical downgrading. And this, in the current climate of skilled professionals being replaced by less qualified or educated staff, becomes a patient safety issue. Clinical safety, patient safety is compromised when cost efficiencies are attempted through compromised staffing. And we know that in stoma care, this not only impacts physiological safety, but will impact psychological health, social interaction, and ultimately physical stability and societal contribution. So being able to defend and evidence our nursing skills is paramount. And yet I'm sure you're not aware that annually stoma care nurses, specialist nurses, are asked to justify our worth, often in an annual review, and effectively we're justifying why we shouldn't be replaced by less expensive colleagues. No other nursing group is expected to do this, because specialist nursing is even poorly understood in the NHS itself. And yet there is evidence of our value, but it isn't understood. Because we are, in fact, expert specialist nurses, registered with a governing body which is set up to protect the public and ensure our practice is safe. We are educated to a high level, often to masters and sometimes higher. Our role is fundamental to patient adaptation and safety. We work autonomously, managing our own caseloads and patient cohorts, and are also required to have high-level specialist clinical skills, advanced clinical reasoning, and complex decision-making and communication skills. No wonder I'm tired, honestly. We lead and contribute to our own teams, collaborate with and contribute to the wider team, devise plans for complex person-centred care, as well as devising wider service improvement and development. We work under something called the 4 pillars of advanced practice, which are leadership, clinical practice, research and education. And we participate, when permitted, in policy setting and review, nationally and regionally, in quality improvement, research and specialist consultancy. And we do all this because we are professionals. But we also do it because we believe that ostomates deserve best practice care and lifelong support, just like any other cohort of patient living with a chronic or a long-term health condition. So this negative assumption or perception matters not just to me as a nurse, but it matters to ostomates too, because the perception we receive of our role impacts the care and the services that ostomates receive. That stigma crosses both of us, the professional, the clinician, and the service user patient. So I've been thinking for a long time, and if you worked in the office with me, you'd be bored of me thinking this, honestly, trust me. My team go, oh, she goes again. But I wanted to know why we were perceived that way, because I honestly believe I have the best job in the NHS. I think I've got the best job in the world. And I don't understand why other people don't understand why this is such an important job. I think it might be because Stoma Care nurses are perceived, we're seen to deliver care, which is clinical and intimate, often called hands-on care. And that is currently less valued in nursing. We've seen those people, carers, people who are cheaper can do that. And in fact, in nursing, advancing your career moves you away from it. The more experienced a nurse, the further away from the patient she is. This isn't the same in other healthcare professions. Care has often been downvalued. It's seen as unskilled and easy. And it's also often called basic, which drives me insane. There is nothing basic about caring for people. It is vital and fundamental. And so all of this rhetoric displays a real lack of understanding of the challenges of delivering best practice care and of how vital care is, and the huge challenge of taking people through one of the most life-changing and impactful events of their lives to adaptation and a good quality of life. There are many ostomates who achieve great things and live well, but there are still those patients for whom having a stoma really impacts them negatively. And as we've heard, and as I always talk about, because it's still in my practice today, those patients who would choose to die rather than have a stoma formed. So, as well as dangerous, this perception is frankly wrong. Most of our work is complex and high level. It requires us to function at an expert, advanced level. And yet I have to tell you now that in the UK there are no mandated pathways for stoma care. So imagine if cancer patients or type 1 diabetics were diagnosed, when they are diagnosed anywhere in the UK, they can be guaranteed that they will get a pathway, an expert peer-reviewed pathway of care, delivered at timely events and in a timely fashion, wherever, whether you're in Manchester or Bristol. That's not the case with Stoma Care. And this is the root of what we call inequitable or non-existent provision of Stoma Care. It's the infamous postcode lottery. And actually, it's not hard to imagine the uproar if type 1 diabetics couldn't get their sensors on the NHS, or if cancer patients didn't have best practice care pathway wherever they're diagnosed. There is, of course, amazing care in Stoma Care. My colleagues work really, really hard, and there's some great innovation. But without a national overview or national standardisation, this doesn't necessarily disseminate out, and it's often not even shared amongst us. Without national standards or a joined-up knowledge of our work, despite the critical and complex nature of it, and despite being an evidence-based profession, we are currently very hard-pressed to provide the evidence and demonstrate our worth. And if we can't show our value, then we are not valued, which means we are often under-resourced. And I know this isn't a rarity in the NHS, but it does impact, because we have no time to produce very basic audits, quality of life, or receive patient feedback, let alone contribute to or lead our own research. Other nurses, because of the standards required by NHSE targets or Department of Health targets, cancer organisations they're affiliated to, they have mandated pathways. The trusts, the ICBs, are under no illusion that they should exist and that they should be funded and resourced. That isn't the same for Stoma Care. I know the Stoma Care landscape is complex, but diabetes care is complex, and with an estimated 205,000 ostomates in the UK, and just over this number of type 1 diabetics, complex shouldn't preclude excellence of provision. And we still haven't got to the very depths of our role, where in fact the vital nature of nursing is exposed. In nursing, specialist nursing, we talk about brokering, rescue work and vigilance, which is the essence of what makes us so impactful regarding patient safety and quality of life. Brokering means that people living with long-term conditions can access timely support, live well and thrive. The rescue work means that bumps in the road don't become massive craters and are managed efficiently so they don't become big potholes. And vigilance means that a simple phone call can be the difference for an ostomate between a rough day and a healthcare emergency. And I am incredibly proud of all these high-level skills that I consider to be advanced, but I am equally proud of the so-called soft skills, which we are also expert in. The skills that mean the relationships that we build impact us all. This is me 2 years ago at the wedding of a former patient who got married after 5 years of treatment and is now living cancer-free. These soft skills, which are often underrated and are really difficult to measure, yet equally valuable because they are the skills that make the life saved worth living. Because quality of life is an outcome which is difficult to measure, but of the utmost importance, and it's personal to each and every one of us, and we all deserve it. So, at ASCN, we are an organisation that advocates for Stoma Care nurses. And in nursing, we know that we must react, respond, but this project is about us being proactive. We've had years of building foundations, progressing clinical skills and knowledge, and ensuring we keep our practice evidence-based, safe, with best for outcomes and experience and peer validation, research and updates. But this project, we are going to be truly proactive because we're going to lead all of that at policy level. Because nurses are safety critical, we keep people safe. We can keep the NHS safe. We are a safety critical profession. And like I said, this isn't just clinical, this should be at a policy level. Because there's also, if we're not looking after ourselves, this symbiotic relationship between ostomates and nurses. If we're not looking after ourselves, nurses, and effectively advocating for ourselves, there is a risk to us too. Because what we do requires not only an advanced education, but experience and critical thinking. We make complex assessments, deliver complicated care, counsel and guide, and make decisions that daily require us to reflect, rethink, and if I'm honest, often lose sleep over. There is an emotional impact to the work we do, not just because of the lives we see and the caseloads we manage, but there is a personal cost to the care we give. We must look after each other and ourselves. And as I've said, there is also a cost to our patients. This symbiotic therapeutic relationship means our standing or lack of it impacts ostomate services. So actually working together through this project, we're advocating for each other. This is really vital to ASCN UK. We're going to make the change to secure the profession for the patients and each other. So the project, you can ask me afterwards about the project, and the IA have been amazingly supportive of it. We're developing this work, and it's got 4 pathways. I won't bore you with all the detail, but it's 4 pathways looking at how we're going to ensure that care is commissioned effectively across the UK. And it has been adopted by a programme called NHS England Getting It Right First Time. With the changes at NHS England, we are assured that the Getting It Right First Time teams will still be in place, but they may have a new name because we like to rebrand everything. It'll definitely just be initials. It won't be a simple name like Bob. It's currently an NHS England programme of work that will look at standards and adherence to those standards. The good thing about GIRFT is it's already established, it's already understood by the powers that be, so we're not introducing anything new, so the rollout should be quite simple, she says. We have gathered evidence of what exists now. We will look at what best practice is based on all the available evidence we've got. But the most important thing, as I said, is that we work with the patient at the centre. So we know that there's variance in stoma care across the UK because of the difference in demographics, in populations, in geography. So we want to make sure that we're not making anybody do anything that's not achievable, but we're making sure that the patient is at the centre, so it's the contact points for the patient that will be important. The ostomate is the focus. We're working very closely with all of our stakeholders. Our industry partners are involved, as are our charity sector. And as I said, IA have been supportive and morally invested in this project from the beginning. So we're really grateful for that. ASCN UK is a charity. we are accountable to our members in how we spend our funds and how we act on their behalf, representing them and demonstrating their worth. But we do that because we know that our members are advocating for ostomates. So ASCN UK is also working for ostomates, which is why they are at the centre of this. So, I just want to remind you of something because it still blows my mind. There is no statutory mandation that states that Stoma Care Services should exist. And honestly, that still shocks me. The lack of national cohesion means that there can be unwarranted variance. And this variance can lead to differing outcomes. Health outcomes mean the difference between being alive and living well. This project has been in progress for several years, actually since 2018, and now that you've done yours, Gordon, it does feel a bit Sisyphean, I'm afraid. But it will get there. We have gone down several blind alleys and round a few cul-de-sacs, but I think we've been moving it forward all the time, and we have been learning. Some of the things you can see we've done, we've published articles, we've produced podcasts, we've gathered together our stakeholders and devised the 4 working groups. We've also mastered the art of being a giant thorn in certain people's sides and talking very loudly until they acquiesce or listen to us. But most importantly is our experts by experience who are bringing their expertise to this piece. The next steps are the bigger steps. We are going to be applying to the National Institute of Healthcare Research for funding, possibly to fund a doctorate role, because we need to find more evidence and establish best practice. But we won't shy away from any of that because it's so important and we're so passionate about the project. So we've also, in light of what Gordon's just been talking about, tried to align our messaging with the latest government recommendations, particularly Wes Streeting's 3 shifts. Don't say that when you've had a glass of wine. So we're trying to make sure that our message chimes with latest policy, because as Gordon's alluded to, you never get the same person that you talk to. You can talk passionately about your subject for hours on end, only for the next month to have to do it over again to someone who's, as he says, very equally enthusiastic but has really not got a clue. So we are learning all the way as we go along. And I just wanted to put this into context of why we're having to do this. The healthcare sector is changing radically all the time. It's in a state of flux all the time. But actually, now is the time for nurses to really be advocating for themselves. Now is the time for things at policy level to be led clinically. Yes, we need our managers, we need our commissioners, but we need clinicians to be driving forward. And never more have we needed that in nursing. Nursing is globally in a period of flux. There's been industrial action in this country, but not just in this country. And in fact, in nursing, it's a bit like a ricochet effect. Nothing happens anywhere without it then seeming to happen elsewhere. So devising standards to protect services, but also protect us as professionals is really, really important. And also because, frustratingly, nurses are often not invited to the table. Most recently, and in the last 2 weeks, there has been a nursing voice at the COVID inquiry, but until that, there wasn't. You don't see nurses as policy makers, chief executives, CEOs, ministers, and national advocates. They are there, but they are rare. And yet, nursing is the single largest profession in the NHS. So I say we should take our place at the table, even if it means bringing our own chairs. And, in fact, not that I want to depress anyone, but the landscape for nursing actually continues to get worse. There's a 19% reduction in applications for nursing degrees, meaning there will be a real shortfall of nurses in the future. And this isn't just bodies, but this is expertise and experience and education. We rejected the last pay claim, however long it was ago, so that means that there will be a continued fight for nursing rights. Our medical colleagues, I'm not immune to the fact that they face similar challenges, but they seem to respond very differently. They're much more collected and more vocal. And again, if you were in my office with me, you'd be bored to tears by why I think that is, because I've talked about it endlessly. But it is perhaps because we are a predominantly female profession, and we're not used to speaking out so much. We work within a societal patriarchy, but the NHS is quite patriarchal as well. I also think maybe sometimes nurses think they need to be helpful, and being helpful means being quiet and compliant. You might gather that I'm neither of those. I'm quite helpful. I'm not very quiet. I actually think true advocacy means we need to be quite loud. Our leadership also hasn't been great. The RCN and the NMC have had their own challenges. So again, this is another reason for us to advocate at our departmental, at our clinical level. It's quite hard to speak out, but it's always worth it. And in fact, you will be aware of the current reviews of the Department of Health with the Part 9 and the NICE late-stage assessment for colostomy bags. I have to be honest with you, at ASCN UK we had to fight to have a place at those tables too, which shocks me. So Stoma Care is also complicated because of its commissioning and funding. We've got sponsorship, company nurses, prescribing services. They all contribute to a lack of understanding of the piece and maybe a variance in delivery and experience for the ostomate. And also, perception of expensive is important in healthcare. So Stoma Care is seen to require a big budget from the Department of Health. But actually, the UK pays less per head for its NHS. It's got less bed base, and until the last government was still a global leader for many outcomes and experience. So when people like the Department of Health or NICE are looking at products and services, and they're looking for evidence for efficiency and efficacy, we have to be at that table. We have to be there, we have to have the standing and the gravitas and the evidence to defend, fight and demonstrate our worth where it matters, for patients, for ourselves and for services. Because I believe we should be policymakers, not just bag changers, although you cannot underestimate a good bag change, I think. So this is why this project positions us as leaders in policy. This landscape, the current healthcare landscape, impacts us all because we are actually all patients. And we are all impacted by poor services and lack of national investment. It matters to us all. There is no us and them. You can tell I feel passionate about this because my profession matters to me. But I also consider it part of my professional responsibility to advocate for my patients. And this project is doing that. This is an ASCN UK project, and I've been involved from the beginning. And I'm invested in its success because I believe it will make a difference for ostomates, to the specialism and profession that I am so proud to represent. I'm honoured to be part of this project, honoured that ASCN UK are leading such a groundbreaking, unique work. And I'm really excited that at last nurses have the chance to create a lasting legacy for us all. And I'm incredibly grateful that you let me share it with you. Thank you.